I think Halloween candy is the big threat to your kids' teeth this time of year, but a bigger risk, get this, cough drops.
Our Lily Celeste spoke to a local dentist about what you should avoid as we head into the flu season.
It's a scary time for teeth. Halloween is less than a week away, and it's cold and flu season. Pharr dentist Dr. Monica Cordova says the sugars in cough drops and cough syrups coat your teeth, and combined with your mouth's bacteria.
Whenever the bacteria have that sugar, then they release an acid, and then it's the acid that causes the cavity.
Angie Prospero has a 3-year-old son, and like most little ones, hygiene isn't a priority.
It's very important to me. It's one of the most challenging things because, he's a little boy. He doesn't like to shower or brush his teeth or anything, but I have to.
As a mom, she does her best to get him to keep his teeth clean. When it comes to sore throats, Prospero keeps the cough drops away.
I actually don't really use a lot of medicines unless he gets a fever. So I usually just lean more to like teas and stuff like that for his cough.
If you stick to the classic remedies, Dr. Cordova has some tips.
You want to buy sugar-free cough drops.
But if a little sweetness is the only option,
eat the cough drop before you brush your teeth. That way the sugar is removed from the tooth. If they've already brushed their teeth and you just by chance give them the medication, make sure to give them water so that they can rinse their mouths.
She also says using cough drops over a long period of time is worse than having 2 or 3 in one day.
If you're constantly having to pop in a cough drop and constantly eating the cough drop with sugar, that's when the cavities occur.
In Pharr, Lily Celeste, Channel 5 News.